Good afternoon, everyone, and welcome to Ladies First on BNC. I'm Laverne McGee.
And I'm Jane Marks, and we have lots to talk about. Thank you so much for joining us. We've got a lot to share with you.
We sure do. And when we first started Ladies First and BNC, we wanted to make sure that we were offering our viewers the most up-to-date information, the latest. We want to make sure that our families and our communities are taken care of. So our show today, of course, is got a lot of information, a lot more than we would normally have on health matters, but we want to give you as much as we can information on the coronavirus. We're journalists here, we care about our community, and we're committed to making sure that we give you the latest information so you can take care of yourself and your loved ones.
And we also want to say happy St. Patrick's Day. Laverne and I are dressing appropriately for the date. So in addition to giving you the very best information, happy St. Patrick's Day.
Absolutely. Well, we start with telling you that there are more than 5,000 cases of the novel coronavirus in the U.S. That's according to data from state and local health agencies, governments, and the U.S. Centers for Disease Control and Prevention. There are 4,940 cases in 49 states, Washington, D.C., and U.S. territories. The CDC says there are 70 cases from repatriated citizens, and that brings the total to 5,010. Meanwhile, a total of 97 people have died in the U.S. West Virginia remains the only state without any reported cases of COVID-19.
And the White House today announced that it supported the idea of sending cash payments directly to Americans. Treasury Secretary Steven Mnuchin said that the administration is talking to Congress about sending checks to Americans over the next 2 weeks to cushion the economic blow of this pandemic. The president has instructed that we may have to do this now, he said at a briefing. It was a shift in priority for this administration, which has been advocating payroll tax cut. And it comes as the coronavirus begins to grind large swaths of the economy to a grinding halt. Cost an increasing number of people their jobs and continue to send the markets reeling.
The Trump administration today announced expanded Medicare telehealth coverage that will enable beneficiaries to receive a wider range of healthcare services from their doctors without having to travel to a healthcare facility. Beginning on March 6, 2020, Medicare, administered by the Centers for Medicare and Medicaid Services, will temporarily pay clinicians to provide telehealth services for beneficiaries residing across the entire country. Prior to this announcement, Medicare was only allowed to pay clinicians for telehealth services such as routine visits in certain circumstances. For example, the beneficiary receiving the services must live in a rural area and travel to a local medical facility to get telehealth services from a doctor in a remote location. In addition, the beneficiary would generally not be allowed to receive telehealth services in their home. So you're seeing that the Trump administration is really taking drastic steps to provide proper health care services to Americans. So let's talk about the financial issue part of this. At first, they did not want to give Americans a cash payout. They were trying to go more to a payroll tax. The reason why a lot of people did not want that in the government is because that would be a delayed reaction. The critical issue here right now is that Americans have money to pump in the system so that things don't stop to a grinding halt. That's one of the critical issues here, aside from the healthcare issue.
Well, the other issue that of course is close to me is the telemedicine.